Did you know that over 80% of American men over 60 are silently losing their manhood, all because of a devastating misunderstanding? No, it's not because of old age, not fate, and certainly not something that must happen just because your hair turns gray or your belly starts to hang over the 38-inch waistband of your jeans. The truth is even worse. By believing that getting older means it's normal for the little guy to weaken, most American men have abandoned themselves only to end up not just losing their ability, but also their confidence, their self-respect, and the precious intimacy with their partner. I've witnessed this thousands of times in over 30 years as a urologist here in the US. Every day, my clinic in Houston welcomes countless older American men. They sit there on the leather chair, hands gripping their baseball caps, eyes avoiding mine, voices dropping low as they say to me, "Doc, I guess I'm just old now, past my prime." They're often so embarrassed they can't bring themselves to share details, but when I probe gently and create a safe space for them to open up, it turns out there's an entire storm of worry underneath. They're afraid of failing each time they're intimate with their wife, afraid of the concerned look from the woman who's walked with them through more than half a lifetime, afraid they're no longer a real man. But as a doctor who's treated and counseled thousands of American patients in their 60s and 70s, I can tell you this with certainty. It's not the end. It's simply a warning sign telling you it's time to start taking care of the little guy, just like you had to learn to care for your heart, your joints, or your brain. I know some might give a soft chuckle and object, but "Doc, I'm old, why bother?" Or, "I don't need to be like a young stud anymore." Right, you don't need to run bedroom marathons like when you were 25, but you still have happiness, you still have a wife, you still have a relationship worth keeping close, loving. This isn't just about sex, it's about preserving dignity, self-respect, and the connection that sustains American marriages for 30 to 40 years. I've met plenty of 70-year-old gentlemen, German Americans in Minnesota, Italian Americans in New York, who thought they were just living out their days to watch TV, sip morning coffee, and wait for the grandkids to visit. Yet after just a few months of following very simple guidance, I shared at no expensive cost, no meds. They came back to my clinic, eyes glowing, proudly telling me, "Doc, my wife says I'm even more affectionate now than when we first married, and I myself feel like I'm still truly a man." But to get there, they had to bravely change, had to overcome the mistaken beliefs most American men over 60 still cling to. They learned to care for the little guy the same way they care for their heart, lungs, or blood pressure. The most interesting part is they didn't need Viagra right away, didn't have to spend hundreds a month on prescriptions. By simply understanding the principles and practicing small, consistent habits, everything gradually changed. I want you to imagine, one morning you wake up on your queen-size bed, no longer wearing tight underwear like you used to, feeling relaxed, at ease. That afternoon, you take a brisk 30-minute walk around the park near your house, your heart pumping strong, blood flowing well throughout your body, including the area you're shy to mention. And that evening, you and the wife who's been by your side for decades can hold each other a little longer without the awkwardness or worry of failing halfway. That's not a dream. It's perfectly normal physiology for American men at 60 to 70 if they just start paying attention the right way. In the next part, I'll share with you 5 simple secrets, proven through thousands of real cases and research from Mayo Clinic, Cleveland Clinic, to help keep the little guy healthy, reduce the risk of shrinking, painful bending, loss of function, and above all, preserve the confidence and dignity every man in America deserves. Are you ready? Let's get started right now. You know, over the past 3 decades, I've been fortunate enough to accompany thousands of older American patients. As a urologist, my job isn't just treating urinary tract infections, kidney stones, or prostate cancer, but also listening to the most private stories. Things many gentlemen in their 60s and 70s rarely dare to speak about, even with the partner who's been by their side for decades. I've spent countless hours in my clinic in Houston, sitting on an old leather chair across from silver-haired American men, their skins sun-worn from a lifetime of driving trucks cross-country or working as mechanics in factories up in Ohio. They often start with a bit of small talk, asking me if the Astros won today or not. Then their eyes drop as they sigh, "Doc, these days I just don't feel like myself anymore." When I gently open the door for them, they admit they're afraid they can no longer be close to their wife, afraid that every night in bed will just end with a half-hearted cuddle, missing the passion that was always such a real part of love. And then they blame themselves, thinking, men at this age, that's just how it is. But I always tell them, and now I want to tell you, that's not inevitable. Yes, age changes the body. Testosterone drops. Blood vessels don't stay as elastic as when you were 30. But most of the problem comes from how we've let the health of the little guy quietly fade, like a house left abandoned, gathering dust simply because we thought it no longer mattered. Throughout my career, I've seen truly amazing things. I once witnessed a 68-year-old Irish American, after following some very simple guidance I gave him, come back to my clinic with a smile I'd never seen on his face before. He said, "Doc, my wife and I just took a weekend trip to Florida, and I haven't seen her that happy in over a decade." Sometimes just a small revival of sexual function can bring along joy, confidence, and love that both thought had grown old with the years. That's why I've always considered counseling on men's sexual health, especially with older American patients, just as important as checking their kidneys, bladder, or prostate, because it's not only the penis that needs care, it's also a man's self-respect, intimacy, and dignity. So many studies from Mayo Clinic, Harvard Health have confirmed. Male sexual function isn't just a gift left over from youth. It directly reflects cardiovascular, metabolic, and neurological health. When an older man tells me he can't get or stay hard like he used to, I don't just think about helping him get back in the game. I immediately think about the hidden risks of heart disease, diabetes, high blood pressure, the things silently killing American men more than anything else. That's why taking care of the little guy isn't some luxury or embarrassment. It's an essential part of maintaining overall health, so you can keep playing golf, driving cross country to visit your kids in Seattle, or camping by Lake Michigan with your wife without worrying you're already past your time. You see, my work has never just been about writing prescriptions. I'm a companion, someone who helps you hold on to a very important part of yourself that too many American men have neglected for far too long. And today I want to walk you through each step, each secret, so you can protect not just the health of the little guy, but also your pride and the manhood that nothing else can replace. We'll start right now. Once you understand the importance of taking care of your sexual health, I want to take you straight into the most practical things. The 5 secrets I've distilled over more than 30 years of treating thousands of older American patients. These aren't internet tips, they're not supplement ads. These are what science has confirmed, and more importantly, I've personally witnessed their effectiveness in ordinary American men living in Texas, Ohio, California. Men who once thought they were out of chances. The first thing I always tell my patients is to maintain sexual activity, even if it doesn't always lead to actual intercourse. The little guy is just like your biceps or thigh muscles. Use it or lose it. When you neglect it, blood doesn't get pumped there regularly. The tissue starts to harden and shrink, leading to what medicine calls disuse atrophy. I had a 72-year-old patient in Phoenix who went 5 years without being intimate with his wife because of shame. By the time he finally worked up the courage to come see me, his penile tissue already showed clear fibrosis on ultrasound. But by starting Kegel exercises and using an FDA-approved vacuum erection device, after just a few months he'd improved dramatically. And more importantly, he began reconnecting with his wife, no longer avoiding her eyes each night. The second thing might sound too simple, but it's the silent cause behind countless problems. Proper hygiene. The skin of the penis, especially once you're past 60, is thinner and less elastic, easily damaged. If you're uncircumcised, it's even more important to gently pull it back, wash thoroughly with warm water and unscented soap, then dry it completely. Don't underestimate drying, because moisture is exactly where bacteria thrive. I once treated a Polish-American patient in Chicago with balanitis simply because all his life he'd only splashed a little, never dried properly, and as he aged, his immune system weakened, giving bacteria an easy chance to take hold. The third thing very few American men realize: never start intercourse until the penis is fully hard. When it's not yet firm, the erectile chambers inside haven't reached enough pressure to protect the microvessels, and if you try to have sex anyway, Those tiny blood vessels suffer micro-injuries. A few times isn't a problem, but accumulated over decades, it forms scar tissue, fibrosis, leading to peyronie's, painful curvature of the penis. I have patients over 65 who ended up needing corrective surgery because it was too late for medication. Just by being a bit more patient, using lubrication, giving your body time to reach full erection, you can avoid so much pain later on. The fourth secret, also the quiet issue most American men never discuss: excessive porn use. Porn is everywhere, easy with just one click, but it rewires the brain to only respond to unrealistic, super fast images. Many of my patients say they still have desire, but when they're with their wife, their body just doesn't respond. It's not their fault. It's their brain accustomed to artificial stimulation. I advise them to gradually cut back and instead focus on real feelings, touch, conversation, to retrain arousal in a natural way. Finally, more important than any pill is lifestyle. A healthy penis needs healthy blood vessels. You can easily manage this by brisk walking 30 minutes a day, keeping your BMI around 25 to 27 by pounds and inches, eating plenty of greens, berries, salmon, things you can pick up at Walmart or Kroger. When I say don't jump to meds right away, many Americans are surprised. But after a few months of these practices, they come back not only with firmer erections, but also sleeping better, feeling more upbeat, and having stable blood pressure. You see, there's no miracle, only simple, doable secrets if you start today. And I promise, the reward isn't just about the bedroom, it's the confidence, the pride that every American man deserves, whether you're 60 or 75. We'll keep going so you can truly take back control of your body. There's a piece of advice that at first sounds trivial, even makes some people burst out laughing when I mention it for the first time, but later they thank me for having the courage to bring it up. It is this: sleep without wearing tight underwear. You might think, what does that possibly have to do with my little guy's health? But in reality, this is a habit that means a lot, and most older American men overlook it. When you sleep, your body goes into repair mode, healing itself. Specifically for the penis, it even has natural nighttime erections. This is to maintain oxygen, keep the tissue healthy, and prevent fibrosis. If you wear tight briefs or snug boxers all night, those physiological erections get compressed, blood flow is reduced, and over time it can cause irritation or even create hidden microscars. I once treated a patient in his 70s from New Jersey. He had mild pain, a curvature in his penis, without any clear cause. After ruling out metabolic diseases, the only thing we found was his lifelong habit, for over 40 years, of always wearing tight underwear to bed because it felt neat, kept things in place. Sometimes it's exactly these small habits that quietly build into big problems. Sleeping without underwear, just wearing loose shorts, or even going completely nude allows your body to function freely, letting blood naturally nourish the erectile tissues throughout the night. It's a change that costs absolutely nothing, but can help you protect long-term performance. And most importantly, it's a way to honor your own body, letting it breathe and recover instead of being silently squeezed through an entire long night. You might think that everything I've just talked about, from maintaining sexual activity, careful hygiene, patiently waiting for full erection, avoiding dependence on porn, to sleeping without tight underwear, all revolves around bedroom matters. But the truth is, it's so much bigger than that. I've examined and spoken with countless American men over 60, men who wore hard hats for decades on construction sites or drove trucks across thousands of highway miles in Texas, Arizona. They all share one thing: pride. Pride so deep that when their bodies start to betray them, they silently endure it, not daring to tell their wives nor seeking out a doctor. But because of that very pride, they carry a hidden pain inside. Think about it. How could a man not feel heartbroken when he senses he no longer has the strength to be close to the woman who stood by him through life's ups and downs? How could he not ache when, instead of lying next to his wife with confidence, he turns his back to the wall out of fear he'll fail? But then I've also seen those men's eyes light up again. I still vividly remember a 66-year-old American patient who had worked as an aircraft mechanic in Dallas. He came to my clinic after nearly 2 years of avoiding intimacy, thinking it was just a young man's game. Yet after only 3 months of changing a few small habits, when he returned for a follow-up, his eyes were shining. He took my hand, gripped it tight, and said, "Doc, she doesn't look sad at me anymore, and I feel like myself again." That is exactly why I view taking care of sexual health not just as satisfying some carnal need. It's about dignity, pride, and the love a man shows himself. You might take care of your heart by walking, eating greens, cutting down on hard liquor. You might check your blood pressure, your cholesterol to avoid a stroke. So why see taking care of the little guy as something to be ashamed of? Because the penis isn't just another body part. It's tied to a man's quiet pride. Whether you're a silver-haired retiree in Florida or still working part-time at Home Depot stores across America. And when you care for it well, it's not just the little guy that gets healthier. Your eyes, your smile, your very stride change. Your wife will feel it. Your kids and grandkids will see a dad, a grandpa still full of life, still wanting to enjoy each day, not just exist. I say all this not to scare you, and certainly not to sell you a pill. I say it because I've witnessed too many American men rediscover themselves simply by finally giving proper attention to the part of their body they once neglected. And I hope the same will happen for you. Taking care of your sexual health doesn't make you weak. On the contrary, it's the most quiet yet powerful declaration of a man who respects himself, who cherishes the body that has carried him through so many years of life. That is the truest kind of strength, and you deserve to keep that for yourself and for the woman still holding your hand as you walk down the rest of this road together. You know, I could sit here for hours talking about physiology, about studies from Mayo Clinic or Harvard Health, but all of that would just stay as words on paper if you don't decide to do something for yourself starting today. I'm not asking you to change everything all at once. I just hope you'll pick one small thing to start with. Maybe tonight, you try skipping the tight underwear when you go to bed, letting your body breathe, operate freely the way it's meant to. Or tomorrow morning, you take an extra 10-minute walk around your neighborhood in New Jersey, California, or Texas. Places you usually just drive through instead of stepping out to take a breath. Or this weekend, you spend a little more time holding the hand of the wife who's patiently waited for you so that intimacy doesn't feel like some distant luxury. And if there's one thing I want you to do right now, it's to leave me a sign. Leave me a note, a comment, even just a single word, agree, so I know you're ready to care about your own health. Don't hesitate to share this message with a buddy, a brother, or the neighbor who once camped by Lake Michigan with you. So they're reminded too that sexual health isn't some private shame, but something a true man has every right to proudly protect. Because you're not just living for yourself, but also for the one waiting to see you smile with confidence each morning. And if you ever need it, I'll always be right here to walk this road with you as you find your way back to yourself. You may not realize it, but right now, the fact that you're still patiently sitting here, listening to me share all this, is already something incredibly valuable. It tells me that you still care about yourself, that there's still a desire in you to be strong, confident, and enough love left to keep nurturing the happiness with the partner who stood by your side all these years. I've met so many American men over 60 who just shake their heads with a wry smile whenever I bring up taking care of the little guy. They say, "Come on, doc, I'm old, why bother anymore?" But deep in their eyes is regret. They no longer reach out for intimacy, don't dare put a hand on their wife's shoulder while watching TV at night, simply because they're afraid they're not as capable as before. And I always feel sorry for them, because if they just started a little, the outcome could have been so different. You're not like them. You've listened to me all these past minutes, agreed to let me walk with you, opened your heart to hear things that are sometimes hard to put into words. That's already a big step, one not every man has the courage to take. So I want you to do one more thing, something small, but it'll help keep this flame burning long into the future. Hit the subscribe button, turn on notifications, or follow the page where you're watching this video. Because health isn't a one-time project, it's a lifelong journey. I'll have much more to share with you. Exercises to improve blood flow to the penis, ways to eat so your testosterone doesn't drop too quickly, little tips to avoid infections older American men so often face. And if this video struck something inside you, maybe a wake-up call, or simply a gentle reminder that you can still do more for yourself, hit like so I know you're still here. That's also how YouTube will prioritize showing you more valuable videos on men's health at 60 plus instead of getting you lost in flashy ads with little real worth. Finally, share this video. Send it to that old golf buddy you still meet on weekends. Send it to your older brother who's still driving his F-150 to work even past 65. Send it to anyone you think might need to hear these words so they'll understand they're not alone. And who knows, you might just become the reason someone regains their confidence, happiness, and pride in being a man. Because sexual health isn't a luxury, it's part of your dignity, a very personal piece of pride, so that when you look in the mirror each morning, you still see the resilient man who's weathered so many storms in life. And I promise, as long as you're here, I'll be here too, continuing to bring you the knowledge and the most sincere advice so we can protect that priceless thing together, not just for today, but for the long road ahead. Thank you for taking the time to listen. Hit subscribe, like, and share right now. That's not just supporting me, it's truly a gift you give yourself. Starting a new journey to keep being a complete man at any age. I'm proud to walk this path with you.